So I'm going to be spending some time talking a little bit about a public health approach to prevention, because as you'll see as we move forward, the PAYS is really based on this philosophy, this kind of approach to prevention. But I want to start by talking a little bit about what we have seen as the state of affairs, and probably what you're seeing in your communities and schools as well. I think that we'd all agree that the prevention of drug abuse, school dropout, bullying, and other risk behaviors for our youth obviously is an important thing to address, but it is definitely challenging. So not surprisingly, many communities and schools struggle to reach their prevention goals. And the question is, why does that occur? Well, in our experience, a few reasons can help explain this. First of all, a lot of times communities and schools find themselves chasing after money instead of outcomes. And what we mean by that is, obviously, we're all having to succeed on very limited funds, especially in the field of prevention. And so sometimes we get distracted and go after the money and wherever the money is at, instead of actually kind of keeping and maintaining our focus on the true goal, which is obviously improving outcomes. Secondly, some organizations or schools and communities, there are lots of separate but disconnected efforts and really no single guiding philosophy. And so that can be a challenge and can prevent schools or communities from having the greatest success possible. And finally, there's really tends to be a lack of good data to make data-informed decisions. And so all of these can potentially be barriers to seeing success in our communities and schools around prevention. Now, not unlike other approaches to kind of improving society at large, the goal of a public health approach is aimed at obviously improving outcomes for children, youth, families, and communities. But the key here with a public health approach is the strategy used to get there. Basically, the focus is on using effective programs and practices, and the key part is targeted at strategically identified risk and protective factors. And this is where the PAYS can really play an important role. Now, this picture here describes the primary steps used in a public health approach to prevention. And as you can see, the PAYS can be a really valuable tool in the first three steps here: defining the problem, identifying the risk and protective factors associated with that problem, and then selecting a program or practice designed to address those strategically identified risk and protective factors. Overall, we really think that the PAYS can help to address some of those barriers that we just mentioned. It allows us to focus on the ultimate goal, which is improving public health. We're able to track and use the PAYS as surveillance to track the outcomes that we're interested in. Also, it really uses this public health approach as a guiding philosophy by really focusing in on those strategically identified risk and protective factors and how they're related to specific outcomes of interest. And also, of course, given that it is a survey and it is a data set that's very valuable at the state and the local level, it helps us make data-informed decisions. Now, Jeff explained earlier that in addition to youth behavior such as ATOD use, the PAYS is designed to assess a variety of risk and protective factors which have been shown to be associated with those important behaviors. And this is really one of the real strengths of the PAYS survey. Now, just to make sure we're all on the same page, I want to define what I mean when we refer to risk and protective factors, and we'll also refer to them as RPFs. Now, a risk factor is a condition that increases the likelihood that a youth will develop problem behaviors later in life. For instance, there's research to suggest that children who are exposed to family conflict early in life are at increased risk of developing a variety of problems later on. A protective factor, on the other hand, is a condition that buffers youth from the negative effects of risk and decreases the likelihood that they will develop problem behaviors later in life. A good example of this is if children have a very strong attachment or bond to their family, they might be buffered against, say, the negative effects of school failure or some other risk factor, and therefore have a decreased likelihood they will develop those problems later in life. Now, the PAYS is designed to measure a host of RPFs at several different levels in the community, in the family, in the school, in the individual, and their peers. Now, you may ask, why does PAYS measure these specific risk and protective factors? And the reason is because they've been consistently shown to be predictive of multiple indicators of adolescent health. This table here really represents years and years of research on the links between risk and protective factors and adolescent risk behavior. Now, in the first column here, we have that list of risk factors by each of these various domains: the community, the family, the school, and the individual or peer level. In the subsequent columns, we have a variety of risk behaviors that have been shown to be associated with these various risk and protective factors. Now, if there is a check in one of these boxes, basically what that means is that there's been some research to suggest a link between, for instance, availability of drugs in the community and substance abuse. Now, there are two main things that I'd like you to take away from this table. If you look at an individual row, for example, let's take a look at family conflict, you can see that one risk factor, family conflict in this case, can be related to a multitude of outcomes. In this case, there's research to suggest that there's a link between if a child is exposed to family conflict, they have an increased risk of substance abuse, delinquency, teen pregnancy, school dropout, violence, and depression and anxiety. In other words, the same risk or protective factor may lead to different outcomes. Now, this is a good thing for prevention because it suggests that if we focus on decreasing one risk factor, there's a good chance we'll have an impact on a variety of important outcomes. The second thing I'd like you to notice about this table is that for any one outcome, there may be several different risk or protective factors associated with that outcome. Now, in the context of prevention planning, what this means is that different communities pursuing the same goal, for instance, let's say if a community has the goal of reducing youth delinquency, they might pursue a number of different routes to get there because there's reason to believe that a variety of different risk or protective factors could result in the same outcome. The PACE is designed to help the community determine the most common pathway that kids in that community or school are taking to the outcome, which means that intervening in that pathway, let's say, for instance, pure ATOD use, will have a greater potential population impact for that local community, as opposed to, say, another community where the most prevalent risk factor is parental monitoring, for instance. And we'll get into a specific example a little bit later on that really kind of spells out how a community might go through the process of looking at their risk and protective factor data and making some data-informed decisions on specific programs that they might choose based on that information to address a particular outcome.